Hello, fellow Govs. We are here today to talk about COVID precautions. Recently, our world has been turned upside down by a virus called COVID-19 or coronavirus. So I, along with some fellow seniors at the School of Nursing, are here to talk to you today about the Rona and what specifically you can do to protect you, your family, and friends, and to keep our fellow Govs safe on campus. In other words, we'd like to educate you on the precautions you can take to limit the spread of this virus on our beautiful campus. So first, let's talk about symptoms. What does a positive case of COVID look like? According to the CDC and the guidelines APSU has put out, most common symptoms of COVID include fever and chills, cough, shortness of breath or difficulty breathing, and upper respiratory congestion. You can even have new loss of taste and smell, fatigue, headache, and general muscle pain and body aches, abdominal pain, nausea, vomiting, and diarrhea. Gross, I know, but these are the symptoms. And sometimes you have young adults who are asymptomatic or without symptoms who still test positive for the virus. This is more common than you think. While these symptoms listed are the main symptoms that we know of, having these does not mean that you have COVID-19. It's just a general list of what they've looked at so far. You know your body best, and you should trust your gut. It is always better to be safe than sorry. If you feel that something is off or you're worried you've been exposed or even have the virus, get tested. And please don't be like Homer Simpson with an at-home test. Speaking of getting tested, where do you go to even get tested? On this slide, we have two main places you can go if you need to be tested. They are the Montgomery County Health Department and Boyd Health Services here at APSU in the ARD building. Both of these services offer you safe testing and the ability to manage your symptoms at home with a trained healthcare professional. They are regularly checking in on you and monitoring your symptoms through the phone. Now, let's say you're at home on quarantine, binging Netflix and sleeping a ton, and you start to notice that your shortness of breath is getting worse. You can't move around as much, you're exhausted from taking a few steps, and each breath is getting more and more difficult. Please, if these symptoms are worsening, go to the hospital, ER, and seek treatment. So now that we know what COVID looks like and where to get tested, now we need to talk about what APSU has done to keep us safe. And I'm sure all of these things you've already noticed, like face mask, hand sanitizer, the classes are getting smaller, social distancing is implemented, the designated entrance and exits, and as I've already mentioned, the testing at the ARD building. And when they test, they are also tracking these cases. I'm sure you all have also seen the emails from our school president talking about our COVID numbers and how we remained at manageable levels over the past few weeks. And this is because of those precautions. So why follow them? You haven't gotten it yet. What's the point? Well, the point is this. These actions are based on the most recent available evidence, and this evidence supports that taking these simple steps can help reduce the risk of you catching COVID and the spread of the virus. Now, if APSU has already implemented all of these guidelines, what can you do as a singular student on campus? Well, if you're symptomatic, you can get tested and quarantine. And from quarantine, you can complete the COVID-19 reporting form on the Boyd Health website. You can practice good hand hygiene or good hand washing, making sure you use those hand sanitizing stations and washing your hands thoroughly. You can wear a mask and participate in social distancing by avoiding large gatherings and parties. And like we saw in March, this can be unexpected and numbers can go up, and for our safety, we might have to prepare to go online if necessary. So having that preparedness and taking these precautions can really prepare you for what lies ahead, even if it is unknown. The time of the coronavirus offers a lot of uncertainty. Frankly, none of us know when we can return to normal or if normal is even possible anymore. But instead of fearing the future of uncertainty, we can seize the day and keep ourselves safe and those around us safe from this virus. We as Govs have so much to offer this world, even in a time of unknowns. So let's take these thoughts of safety from campus to our homes, grocery stores, gas stations, and wherever else you may go to help flatten the curve. Alright guys, that's all we have on this topic. Stay safe, wash your hands, mask up, and let's go pee.